Hi everyone, let's continue the second part of the lecture. In this part, we will discuss the case and the management of schizophrenia. Can you manage to identify the symptoms that contribute him to be diagnosed as a schizophrenic patient? Let's read the question first. Mr. J is 35 years old, unemployed man, lost his job, was brought to the emergency department by his family members who complained of him being verbally abusive for about 3 days. He had poor sleep since 4 weeks ago and closed all his bedroom windows and expressed concerns that there were people from causing alarm among the neighbors who were going to kill him. He heard voices of his neighbors talking about him in a negative manner. He was noted to talk to himself since 2 months ago. His condition gradually worsened. He is a smoker and has type 2 diabetes that treated by metformin 500 mg BD and glipizide 5 mg once in morning. He denied any abusing substances. All laboratory examinations were within normal range and unremarkable except his fasting blood sugar level was 8.9 millimole per liter, which is the normal range is about 5 to 7 millimole per liter, and the urine drug screening were negative. The physician diagnosed him as a schizophrenia and prescribed him with olanzapine 10 mg BD. According to DSM-5 and ICD-10, schizophrenia patients should have at least two or more following symptoms that present for a significant period of time for 1 month, which are delusions, hallucination, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Based on the case study, it shows that he presented with psychotic symptoms such as hallucinations in both auditory or visual. He talked to himself about 2 months ago and he heard the voices of his neighbors talking about him. He also experienced delusions, which can be found that he thought that his neighbors were going to kill him, which caused his action to close all the bedroom windows. All these symptoms referring to positive symptoms that due to the hyperdopaminergic activity in the mesolimbic pathway. As a pharmacist, we need to know the pathophysiology underlying the development of schizophrenia so that you can relate the mechanism of action of the antipsychotic drugs in treating these diseases. You might want to recap back Dr. Soraya's lecture on her YouTube channel for further explanations. The Malaysia Clinical Practice Guideline on the Management of Schizophrenia in Adults that published in the year of 2009 stated that monotherapy of antipsychotics, except clozapine, can be used to treat the first episode of schizophrenia. And besides that, we need to monitor the side effects. The rapid tranquilizations, which the combination of intramuscular antipsychotic and intramuscular benzodiazepine can be given if the patient shows any acute agitation during hospitalization. However, in these past 12 years, there are many clinical trials in the treatment of schizophrenia have been conducted and reported. In last year, September 2020, American Psychiatric Association, or also known as APA, has come out a new guideline for the treatment of patients with schizophrenia. The physician need to assess any cigarette or substance use by the patient prior initiating the treatment. The doctor also required to assess the physical health, psychosocial, and cultural factors, as well as the risk of suicide or any aggressive behavior that can endanger the patient himself or the surrounding people. Various factors should be addressed prior initiating the treatment, such as risk for suicide or aggressive behavior, use of tobacco, which we'll discuss later in this video, or other comorbidities that affect the health conditions or psychiatric symptoms and diagnosis. Besides that, the pregnancy or postpartum concerns should be addressed. Besides the pharmacotherapy, psychosocial interventions such as psychoeducation should be initiated together with the pharmacotherapy for the better outcomes. In the pharmacotherapy, antipsychotics remain the first-line agent to treat schizophrenia. The potency of the drugs are equivalent between the classes. However, the differences between the side effect profile of the drugs which contribute to the choosing of the medication in treatment of schizophrenic patients. Let's look back on the case study to discuss the drug-related problems that present in this case. Mr. J was diagnosed as schizophrenia and being treated with olanzapine, which is one of the atypical antipsychotic drugs. He is a smoker and had type 2 diabetes, which the blood glucose is not in the desired range, even though being treated with combination of drug of metformin and glipizide. His urine drug screening shows no substance abuse during that point of time. Can you identify the two drug-related problems from this case study? As you can see in this chart, olanzapine may cause significant glucose abnormalities toward the patient, and it also one of the cytochrome P1A2 substrate. In previous lecture by Dr. Sraya, the most common side effects of atypical antipsychotics are the metabolic side effects such as weight gain. The weight gain will lead to insulin resistance due to obesity and may induce the coronary heart disease if not being controlled properly. Olanzapine can inhibit the secretion of insulin by antagonizing binding at the muscarinic receptor at the beta cell of pancreas. Please recap back the Dr. Sraya YouTube for further explanation. Polycyclic aromatic hydrocarbons, or also known as PAH, that present in the cigarettes may induce the expression of isoenzyme cytochrome 1A1 through transcriptional regulation and isoenzyme cytochrome 1A2 through epigenetic regulation. As we learned in the basic pharmacology, these cytochrome P450 enzymes are responsible for phase 1 drug metabolism by oxidizing the parent compound, which is olanzapine, to a more readily excreted metabolites. The overexpression of the cytochrome 1A2 may decrease the olanzapine plasma concentration, which will reduce the therapeutic efficacy and require higher dose to achieve the therapeutic outcomes. Another problem may issues when these patients stop or in the program of smoking cessation, which will cause toxicity due to the lack of cytochrome 1A2. As a pharmacist, all this information should be provided and discussed to the physician for the benefit of the patients. So, which drug can be recommended to this patient? As you can see here in this table, aripiprazole, which is the second generation antipsychotics, can be recommended as the drugs that be chosen because of do not show any significant increase of glucose level and not the major cytochrome 1A2 substrate. As a conclusion, the two DRP in this case are the olanzapine-induced side effects, which is glucose abnormalities. This olanzapine can cause uncontrolled sugar level. Besides that, olanzapine also may interact with the substance in the cigarettes that induce the isoenzyme cytochrome 1A2 due to olanzapine is the cytochrome 1A2 substrate. So our recommendation is to prescribe aripiprazole 10 mg OD. In this slide, it shows that the list of laboratory assessments should be conducted prior initiating the antipsychotic drugs, such as the body weight and height, hematology and blood chemistry, the fasting blood glucose, HbA1c, and also the lipid profile, the EEG, brain imaging, CT scan or MRI, and also the prolactin levels. Let's have a break before we continue the management of schizophrenia in terms of side effects.